Did you know excessive alcohol consumption is one of the leading causes of liver damage worldwide? This is Dr. Pawan Saagar. I am a homeopathic physician. In today's video, let's understand alcoholic liver disease. Alcoholic liver disease is a condition which is caused by long term excessive consumption of alcohol, which leads to progressive liver damage. Personally, I never recommend anyone to consume alcohol, even if it is occasionally or for a social gathering. But if you are someone who really wants to take alcohol once in a while, then you need to know what are the safe limits to consume alcohol. But I personally believe that even these safe limit amounts of alcohol are not going to do good, because ultimately alcohol is something which will damage your liver and it is not good for the body. So the safe limits for alcohol is 200 grams of alcohol for male per week and 140 grams of alcohol for females per week. This data is according to the Indian Public Health. So let me give you another information, another data where you can calculate what kind of alcohol you're taking, what drink you're taking, and how much alcohol is present in it. So 10 grams of alcohol is present in 30 ml of whiskey. The same way, 10 grams of alcohol is present in 100 ml of wine, and 10 grams of alcohol is present in 250 ml of beer. So, like I already told, for males it is 200 grams of alcohol per week, and for females it is 140 grams of alcohol per week. Your consumption of alcohol should not exceed more than this, because then the rate at which you'll end up in getting alcoholic liver disease gets faster. So that is why this safe limit has been given. So if you are consuming alcohol, I do recommend that you use these informations that I just gave you and calculate how much of alcohol you are consuming every week. So based on this, you will be able to decrease the amount of alcohol that you are taking. If you are someone who takes alcohol every day or 3 to 4 days in a week. Now, another thing that I do tell many people who consume alcohol is that completely stop drinking. But if you are someone who cannot do that, then at least give yourself 3 days of gap when you take alcohol, meaning you should have at least 3 days of gap before you take your next drink, because your liver is a beautiful organ that can regenerate itself. So you have to give this time for your liver to regenerate itself so that it can stay healthy, and through this you will be healthy. Because like I've already mentioned about liver in my previous videos, liver is one such very important organ, and we need to make sure that our liver is healthy. Alcoholic fatty liver disease is divided into three stages based on the severity and the progression of the disease. The first one is alcoholic fatty liver. Now, alcoholic fatty liver is a condition where there is excessive accumulation of fat in your liver because of the uncontrolled alcohol consumption. Now, what happens is that there are no symptoms in fatty liver disease, and that is why many people ignore it. So, if you are someone who consumes alcohol on a regular basis, my suggestion is go and get a blood test done for your liver function, fasting lipids, and an HbA1c. So, through this, what we will see is an elevated level of ALT and AST in your liver function test, and the same way we will see a high triglyceride and a high cholesterol level in your fasting lipid profile. And in HbA1c, which is the 3 months average of the sugar in your hemoglobin, we will see an elevated level of HbA1c if all these parameters are high. So based on this, we will be able to tell if you're suffering from fatty liver disease. Another thing that you can go for is going and getting an abdominal scanning, that is an ultrasound of your abdomen, CT scan, or an MRI of your abdomen. Even through these techniques, we will be able to determine if you are having fatty liver disease. Now, one advantage of fatty liver disease is that this can be completely reversed and you can have a good quality of life. I've made a dedicated video on how you can reverse fatty liver disease at home without any medications. I'll give the link for that and you can watch that video as well. But the problem is many people ignore fatty liver disease and they think it's okay to consume alcohol as long as they're not having any symptoms. But once you start having symptoms, things can go wrong very easily. That is why it is always good to make sure that you are on the right diet, right lifestyle, and either you should stop drinking or at least keep your alcohol consumption under control. If you're going to ignore fatty liver disease, then you will end up in something called as alcoholic hepatitis. Now, alcoholic hepatitis is a condition where there is inflammation of your liver tissue, because of which you will start experiencing a few symptoms like tiredness, weakness, loss of appetite, fever, jaundice. So these are some of the things you'll start experiencing. What happens is that many people will not go and see a doctor until jaundice has set in. So until then, they'll just keep ignoring the other symptoms, and by the time you see jaundice setting in, it will be too late. By the time you get a doctor's help, you go to a hospital. That is why it is very unfortunate that 1 in 3 people who get diagnosed with alcoholic hepatitis die because they reach the hospital too late, they get the medical help too late. But in people who are able to recover from alcoholic hepatitis, we see a good progression in their health and they're able to live healthy, provided that they stop consuming alcohol, get into a good lifestyle, and eat the right food. But if you're someone who's going to ignore all this even after recovering from alcoholic hepatitis, it is going to be very dangerous, because the life expectancy of a person who continues to consume alcohol even after being diagnosed with alcoholic hepatitis is somewhere around 3 to 5 years, because the liver will not be able to handle this amount of alcohol and the damage will not get recovered. That is why it is recommended that you either stop consuming alcohol or at least reduce the amount of alcohol that you're drinking. In many people who get diagnosed with alcoholic hepatitis, what happens is that over a period of time, they tend to forget what they've been through, what they're supposed to do. So they start consuming alcohol in large quantities, meaning they'll again get into the same habit of uncontrolled alcohol consumption. In such cases, what happens is that their condition will get worse and they'll end up in something called as alcoholic cirrhosis. Now, alcoholic cirrhosis is the permanent damage of your liver tissue, which could lead to a complete liver failure or even cancer of the liver. In a study done in the United Kingdom, it is seen that the occurrence of alcoholic cirrhosis becomes 6 times more in people who consume alcohol twice more than the safe limit. Like I already mentioned in the beginning of the video, the safe limit of alcohol for men is 200 grams of alcohol consumption per week, and in females it is 140 grams of alcohol consumption per week. So if you are consuming more than this, then it is bound that you will get into serious complications and it is going to be very dangerous. In a person who is experiencing alcoholic cirrhosis, they will have a few symptoms like tiredness, body pains, abdominal pain, abdominal discomfort, ascites, that is building up of fluid in your abdominal cavity, making your abdomen hard and tense, and then confusion because of a condition called as hepatic encephalopathy, nausea, vomiting, low grade fever. So these are some of the symptoms people experience when they are suffering from alcoholic cirrhosis. If you're suffering with alcoholic cirrhosis, you need not lose hope. That is because people who suffer with alcoholic cirrhosis have an option of liver transplant. Now, I know liver transplant is a difficult option because finding a donor is going to be very difficult, and liver transplants are very expensive for many people. So the other alternative is going for the right medication. Now, a study has proven that with right medication, right lifestyle, and completely stopping alcohol consumption, people are able to live a healthy, long life even when they have alcoholic cirrhosis. As a homeopathic physician, I've treated people who come to me with alcoholic liver disease, even some people who come to me with alcoholic cirrhosis, and homeopathic medicines do wonders on such people. The other thing that I always tell is, no matter what system of medicine that you choose to go for, it could be homeopathy, allopathy, Ayurveda, or some other system of medicine, you need to prioritize your lifestyle, that is, being physically active, eating right, and not consuming alcohol. I know people who suffer, especially with alcoholic cirrhosis, are going to be weak and you will not be able to be physically active. For such people, what I recommend is go for yogasanas. Do simple yogas which are going to help you, along with practicing breathing exercises, that is pranayama, because these are going to make a big difference in your life. I hope this video was educative and helpful. I hope you enjoyed watching this video. Do share this video with people who you think might need to watch this. And the other thing that I would like to tell is, especially for those who consume alcohol, if you're going to be careful now and if you're going to take care of your health now along with the right lifestyle, you will not end up in alcoholic cirrhosis. If you're not going to take yourself seriously, if you're not going to take your life seriously, you will start experiencing the symptoms that I explained in this video, and that might be too late for yourself. So take care. I'll see you in the next video. Bye.